everyone, Stephen from Clubb Dental. I want to talk today about bad breath. Bad breath can be the result of poor oral hygiene. It can also be the effect of eating foods that then create a bit of an odor. The main thing that is important to keep in mind is that some really bad breath problems are not able to be brushed away. For instance, you may have an underlying health problem that may need to be checked out. And what we tend to do is rule out any of the dental related problems that can be generating the bad breath problem. And the first thing that we suggest you do is have your regular checkup every 6 months. And when we see you, if we find a reason such as a hole in your tooth or a gum infection, then that can be treated and that will allow that odor to be eliminated. If it's a dietary thing, well, that can be combated to an extent with an oral hygiene improvement. Brushing, flossing. One thing that a lot of people are not aware of and should be aware of is that a lot of the breath concerns that you can get are generated by plaque that sits on your tongue, on the top surface of your tongue. And if you are able to brush your brush your teeth ordinarily, and then move your toothbrush onto your tongue and try to go back as far as you can without gagging, and clean your tongue, spit out, and you'll see that there's often a bit of a color to what comes out. It's plaque. And your breath may well improve just by way of cleaning your tongue. The other thing, of course, that you can use is a tongue scraper. So you're scraping the plaque off your tongue, and you may well find that if you're doing that every day, you'll be surprised by how much debris comes off your tongue, and you may well notice that your breath is better, or those around you may notice that as well. Once you've done those things and you've got that perfect oral hygiene, you're a great flosser or using little brushes to clean between your teeth, and you're still wondering, why am I aware of this, or why are people complaining? Maybe if you're aware of it after that, the trick might be to start using something like this, which is a mouth rinse, Halitosis, which contains chlorine dioxide, which tastes a little bit like pool water, and it's very effective at knocking down odors that would ordinarily persist. And that includes dietary odors such as onion and garlic, for instance. If you rinse with this, it eliminates the odor, and it stays eliminated for say about 12 hours. And if you use a regular mouth rinse, it will have a temporary effect of freshening your breath, like that minty taste and hopefully a minty smell that's similar to after you brush your teeth, but it seems that the odor returns. With the chlorine dioxide based rinses, you find that the odor stays away for an extended period of time. Again, you've just got to tolerate the taste of pool water when you go to rinse out. One more thing that might be relevant to you is if you're a smoker. If you're a smoker, that's going to generate a breath odor, and obviously you can cover that up to some extent. We would prefer that you use this as an excuse to stop. It's reasonably well combated with oral hygiene measures and such, but the underlying problems that it creates purely from a dental perspective would make it worthwhile using a bad breath concern as a good reason to stop. I hope this has been helpful. If you found it helpful, hit like. If you have any comments or questions, put them in the comments down below. And I look forward to hearing from you. Thank you.